Good day, Miss Grace. I'm Elazar D. Pacalyuga Jr. and I will make a presentation video that will bring awareness to the dangers of drugs and alcohol. So first is cocaine. So what is cocaine? Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant native to South America. So there is a short-term effects and long-term effects of cocaine. So the short-term effects of the cocaine include extreme happiness and energy, mental alertness, hypersensitivity to sight, sound, and touch, irritability, paranoia, extreme and unreasonable distrust of others. Some people find that cocaine helps them perform simple physical and mental tasks more quickly, although others experience the opposite effect. Large amount of cocaine can lead to bizarre, unpredictable, and violent behavior. Cocaine's effects appear almost immediately and disappear within a few minutes to an hour. How long the effects last and how intense they are depend on the method of use. Injecting or smoking cocaine produces a quicker and stronger but shorter lasting high than snorting. The high from snorting cocaine may last 15 to 30 years. The high from smoking may last 5 to 10 minutes. So the long-term effects of cocaine include snorting, loss of smell, nosebleeds, frequent runny nose, and problems with swallowing. Smoking, cough, asthma, respiratory distress, and higher risk of infections like pneumonia, consuming by mouth, severe bowel decay from reduced blood flow, the needle injection, higher risk of contracting HIV, hepatitis C, and other blood-borne disease, skin or soft tissues infections, as well as scarring or collapse veins. So, however, even people involved with non-needle cocaine use place themselves at a risk for HIV because cocaine impairs judgment, which can lead to risky sexual behavior with infected partners. So next is heroin. So what is heroin? Heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of the various of opium poppy plants grown in Southeast and Southwest Asia, Mexico, and Colombia. Heroin can be a white or brown powder or black sticky substance known as black tar heroin. So, what are the effects of heroin? So, there is also a short-term effects and long-term effects of heroin. So, the short-term effects of heroin include euphoria, a dry mouth, warm and flushed skin, arms and legs that feel heavy, upset stomach and vomiting, itching, a fuzzy brain, switching in and out of drowsiness. So, the long-term heroin can lead to collapsed veins, insomnia, infections of your heart lining and valves, skin infections like abscesses and cellulitis, a higher chance of getting HIV or AIDS, hepatitis B and hepatitis C, liver and kidney disease, mental disorders, lung diseases like pneumonia and tuberculosis, menstrual problems and miscarriage. So, heroin addiction treatment. So, your medical team can lead you find the treatment plan that works best for you. It will probably include medication and behavior therapy. Experts says this medication-assisted treatment is the gold standard of care for people who have heroin addiction. Medication can make it easier to wean your body of heroin and reduce cravings. Buprenorphine buprenorphine and methadone work in a similar way to heroin, binding to cells in your brain called opioid receptors. These medicines are safer and longer lasting than heroin. So the next is Adderall. So what is Adderall? Adderall and Medias are trade names for a combination drug called mixed amphetamine salts containing 4 salts of amphetamine. The mixture is composed of equal parts amphetamine and dextroamphetamine, which produces a ratio between dextroamphetamine and levoamphetamine, the two enantiomers of amphetamine. So, what are the effects of Adderall on a normal person? It calms them and most often improves their ability to focus in people who don't have ADHD because Adderall produces an excess amount of dopamine. User may experience feelings of euphoria and increased energy levels, as well as possible dangerous physical and emotional side effects. So the next is methamphetamine. So methamphetamine is a potent central nervous system stimulant that is mainly used as a recreational drug and less commonly as a second-line treatment for attention deficit hyperactivity disorder and obesity. So the effects of using methamphetamine can produce feelings of euphoria, but there are also dangerous side effects. So this includes increased attention, higher levels of activity and talkativeness, decreased appetite, reduced fatigue, a feeling of power and self-control, a pleasurable sense of well-being or euphoria. So there may also be faster breathing, a fast or irregular heartbeat, higher blood pressure, raised body temperature. So the next is magic mushrooms. So what is magic mushrooms? So magic mushrooms, also called shrooms or mushrooms, are a type of mushrooms that contains the drug psilocybin or psilocin. So these drugs cause hallucinations. So psilocybin powder can also come in a capsule form. So the common side effects. So magic mushroom are known to cause nausea, yawning, feeling relaxed or drowsy, introspective experience, nervousness, paranoia, panic, hallucinations, and cyanosis. So the next is alcohol. So what is alcohol? Alcohol is a drink that contains ethanol, a type of alcohol produced by fermentation of grains, fruits, or other sources of sugar that acts as a drug. The consumption of alcohol drinks, often referred to as drinking, plays an important social role in many cultures. So, what is the effects of drugs? Alcohol is a depressant that affects concentration and coordination, slowing reaction times and affecting responses to situations. Hence, the danger when engaging in activities such as driving, working, or sport. In order to fully understand the consequence of drinking, you should first know what constitutes as a drink. A standard drink measures the amount of pure alcohol you are drinking. So the next is marijuana. So what is marijuana? Cannabis, also known as marijuana among other names, is a psychoactive drug from the cannabis plant. Native to Central and South Asia, the cannabis plant has been used as a drug for both recreational and entheogenic purposes in various traditional medicines for centuries. So the effects of cannabis are caused by chemical compounds in the cannabis plant. including 113 different cannabinoids such as tetrahydrocannabinol and 120 terpenes, which allows its drug to have various psychological and physiological effects of the human body. So the next is ecstasy. So ecstasy is a psychoactive drug primarily used for recreational purposes. The desired effects include altered sensations, increased energy, empathy, and pleasure. When taken by mouth, effects begin in 30 to 45 minutes and last 3 to 6 hours. So there is also a long-term effects of ecstasy. There has been little research of the long-term effects of taking ecstasy. Studies suggest that problems may include permanent damage to the brain cells that make the neurotransmitter serotonin, which involve in mood regulation, body temperature, appetite, and sex drive, liver damage, memory and concentration problems, colds or flu, depression, risk of HIV, hepatitis, blood poisoning, or skin abscesses. If ecstasy is injected using shared needles, risk of unpredictable sex, which increase the enhance of contracting sexuality transmissible infects, increased need to use other drugs such as benzodiazepines, alcohol, or cannabis to balance the side effects of ecstasy. So next is what is LSD. Lysergic acid diethylamide, also known colloquially as acid, is a psychedelic drug. Effects typically include intensified thoughts, emotions, and sensory perception. At sufficiently high dosages, LSD manifests primarily visual as well as auditory hallucinations. Thank you.